living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
If you are one of the 61 million enrolled in Medicare right now, or are going to be enrolled and become one of the 80 million by 2030, you're going to want to listen in to this show. We're going to be talking about things to know about enrolling in Medicare next year. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned for more information about Medicare and Medicaid. Don't change that channel. Welcome back to Healthy Living for Life. Joining me today is Janet Stellman, who is the State Health Insurance Program Director for the Montana Department of Public Health and Human Services. Thank you so much, Janet, for being with us.
Thanks for having me.
Yeah.
Glad to be here.
So let's talk first about what SHIP is, which is that State Health Insurance Program.
Right. SHIP stands for State Health Insurance Assistance Program. We are funded by Administration on Community Living, and what we do is we're a bunch of advocates across Montana that help people through the maze of Medicare, whether it be helping people sign up for Medicare, helping them with appeals, letting them know what kind of coverage is available, helping them with some helping programs that are available that helps save them on some premiums. And we're free, we're confidential, we don't have any skin in the game, so we're unbiased, and we're not going to sell you anything, and we're just going to help you make your choice in what's best for your health coverage with Medicare.
Well, I believe I know the answer to this, but who gets to avail themselves of your services?
Anybody with Medicare, any Medicare beneficiary, their family members, their caregivers, or partners in the community too that might have some Medicare questions.
So what about if they're on Medicaid? Do you help them as well, or is it really focused on Medicare?
We do. We're primarily focused on Medicare, but a lot of people we talk to are on, both programs. So we do help both. Yeah.
So where would I go if I needed some help? Who would I call? Where would I go?
Most of our SHIP counselors are located in the area agencies on aging. There's 10 of them across the state. There's one number that I'm sure you guys will put up that they can call, and that number will direct them to their local SHIP counselor. We also have SHIP counselors in some community health centers and independent living centers, urban Indian clinics up on the reservations. So we're kind of spread out all over, but the main number will get you to your local SHIP counselor.
And as I understand it, Janet, there are SHIP coordinators and counselors in every state. Is that true?
Yes, there's SHIPs in every state. Some of them might be called a little bit different, but mainly they're SHIPs. And so, and we have them. They may not live in all 56 counties, but they cover all 56 counties. So
and across the nation, really.
And across the nation, yes.
Yeah,
yes.
That's great. Let's first start talking about Medicare eligibility.
Okay.
So what is the youngest age most people get on Medicare?
Well, most people become eligible for Medicare when they're 65. Some people who are been determined disabled through Social Security, after they've been disabled for 2 years, they can get Medicare at any age, depending on, 2 years after they became disabled through Social Security.
Okay. And so what are some other eligibility requirements for Medicare?
Well, you have to live in the United States, or else have your proper documentation for being a legal citizen. You'll need your Social Security number and your military status, information about other insurance, stuff like that.
And so Medicare at 65, and some people choose to work now after 65, so they can still have Medicare and work.
Correct. It's a good idea for them to contact their human resources to see how their employer insurance is going to work for with Medicare. They may not need to take Medicare right away when they turn 65 if they're still working, and it's especially their drug coverage, if it's as good as or better than Medicare, they don't have to sign up for Part B and a drug benefit. So
Okay, and Part B is the outpatient, correct?
Part B is the doctor services and the DME, the durable medical equipment, and yes, outpatient.
Very good. What if someone has never worked? Are they still eligible for Medicare?
Yep, they can usually draw off a spouse sometimes, or get their Medicare quarters off a spouse. They may have to, like for Part A, which is the doctor services, the premium is like $450 a month if they can't use quarters off a spouse or they don't have enough work quarters for themselves.
So work quarters, what does that really mean?
Work quarters is 10 years of work or 40 work quarters. So that if you have 10 years of work or 40 work quarters, you'll get premium free Part A, and then you'll have your Part B, which is right around $170 a month. So this year.
Okay. So if you have enough quarters or you're eligible, then you don't have to pay as much.
Right.
Okay.
You don't have to pay that $450. You'll get it premium free. So.
Okay. Can someone get Medicare for a spouse as a dependent?
You can get Medicare through their work history too. Yes.
Okay.
So
good to know. And the SHIP counselors can help with this.
Right.
So if someone has a question, they can really go to the SHIP folks for
and that's
their expertise.
the best place for them, and we hope they do. Yes.
Okay. So we've got just about 40 seconds left.
Okay.
Basically, tell us what's the difference between Medicare and Medicaid.
Okay, so Medicare is a federal program, and it started in 1965. It was the first health insurance for seniors or people 65 and older. And it's eligible to anybody that's eligible for it. There's no income or resource guidelines. Medicaid is a state program. Well, it's a federal program, but state rules. And you have to be income and resource and meet other eligibility criteria to be on Medicaid. So.
Well, we're going to take a break now, Janet, but when we come back, I know we're going to talk more about Medicare and Medicaid and the differences. And to our viewers, don't go away. We'll be discussing some common errors that folks make when they sign up for Medicare. So stay tuned. Welcome back. Janet Stellman, the director of SHIP, is still with us, and we're going to be talking about common mistakes that Medicare enrollees can make. Thank you again.
Yes, thank you.
Let's talk about those mistakes, and I imagine they can have some serious financial consequences to folks.
Right.
So talk to us about some of the more common ones and how to avoid them.
One of the most common ones is not signing up when you're first eligible, and not checking that out if you're still working. So we have people that come in and they didn't know they should have signed up at a certain time, and so months go by, and there's penalties. There's penalties for Part A, there's penalties for Part B, and there's penalties for the drug benefit too, if you didn't have other coverage, and especially if your prescription drug coverage wasn't as good as Medicare.
So give us an example, give our viewers an example. So once you turn 65 and you're still working, from what I'm understanding, these folks need to sign up for Medicare even though they are still working?
Well, some of them, it's going to depend on your situation. And again, that's why it's so important to talk to your human resources about how that's going to work. Because you may not need to sign up for Part B, or a drug benefit, but then again, your insurance coverage, like for your prescription coverage, it may not be creditable to Medicare. And so therefore, when you quit working and go to sign up for Medicare, they're going to say, well, your insurance wasn't as good as or better than Medicare, and they're going to tack on a penalty for the prescription drugs benefit. And same with Part B, if you didn't have insurance and come 65, you have 3 months before your 65th birthday, the month of, and 3 months after to sign up. And if you don't sign up during that time and you don't have any other insurance, there's going to be a penalty. And for Part B, it's a 10% per month penalty for every month that you should have had Medicare but didn't. And then the drug benefit is 1% per month. So, and those are forever, those are lifelong penalties. So,
wow.
Yeah.
So our viewers really need to be listening.
Right.
If they are close to 65,
Right.
they need to be paying attention to this.
And
talk
to a SHIP counselor.
A SHIP
Yes.
counselor, and we will be showing that number.
Great.
I know we will be. Let's talk about the special enrollment period, and when does it apply?
Well, special enrollment periods, if you quit working and you had insurance and you're losing your insurance because you quit working, you have so many days or so many months to sign up for Medicare Part B and also Part D. So if you don't sign up during those special enrollment periods, then you could get a penalty for not signing up when you do. There's also times, especially for prescription drugs, that most people are stuck in a plan all year long. So if they don't like their plan, a lot of times they have to stay in their plans. But certain people qualify for a special enrollment period, which means they can get into a plan mid-year, a drug plan, or a Medicare Advantage plan mid-year, because they qualify under special circumstances. So maybe they move, or they go in or out of a long-term care facility, or they become eligible for extra help, or the Medicare Savings Program.
So if the employee insurance becomes your secondary coverage, why is it still important to sign up for Medicare? I know we've been asked that before.
Yeah, because you need the primary there to pay the bill. We talked to somebody a couple of years ago that they went along and they didn't, they had employer insurance from their work, but there was like under 100 employees, and so that makes a difference. And they didn't sign up for Medicare, and so the health insurance came back and tried to recoup some of the money they paid out because the person didn't have Medicare.
Wow.
So, yeah.
Yeah, so we see in the fall, we see a lot of ads on television,
Yes.
right? So should folks pay attention to calling those numbers, or should they call the local SHIP?
We recommend calling the local SHIP. The reason being is those television ads that you see on TV, they are not talking specifically about Montana. We get so many calls about those ads, wanting some of the things that they promise, and that's not how it works in Montana, and we don't need to know your zip code. We'll help anybody, and we'll look for any benefits you may be eligible for. So
Call SHIP.
Yep, we are not an insurance company, and we are unbiased, and we're not going to sell you something. We're just going to help you make the decision. So
That's right, and you're local, which is great.
we're local. Yep.
What are some of the differences between Medicare, regular Medicare, and Medicare Advantage? That's a confusing topic.
So Medicare is, you have your Part A, which is your inpatient or your hospital services. You have Part B, which is your outpatient, your doctors, your DME, durable medical equipment. We're going to skip over Part C for a minute, and then you have your Part D, which is your drug benefit. And so so you have all those different parts. Traditional Medicare is an 80-20 split. So you're paying 20% where Medicare is paying 80%. After all the deductibles, there's a deductible for Part A and a deductible for Part B, and there's deductibles for Part D too. Medicare Advantages are, Medicare gives this pot of money to these companies and say, okay, you take care of their Medicare services. It has to pay everything traditional Medicare pays. It may be a little bit different, and there may be some extra benefits.
Wonderful. So we have to take a break, Janet.
Okay.
But when we come back, I'd like to have some follow-on about Medicare Advantage.
Yes.
And we'll talk about advantages and disadvantages.
Yep.
So viewers, stay tuned. We've got more to cover with Janet Stellman. Welcome back. Thankfully, Janet Stellman is still with us, and we're going to be talking more about Medicare and Medicaid enrollment. Okay, let's do a follow-on question more about Medicare Advantage.
Right. So with Medicare Advantage, there's most of the time you have to go to a doctor that is a preferred doctor, preferred provider, or somebody in network to get the best prices. Whereas with traditional Medicare, you can just go to any doctor that accepts Medicare. The other thing about Medicare Advantage plans is that they have maximum out of pocket. So once you reach $6,000, $10,000 out of pocket, the insurance company is going to pay the rest of your medical for the rest of the year. So
Okay.
those are two differences. Where traditional Medicare, you're 20% throughout the whole year. So
Okay.
there's definitely, some people love Medicare Advantages and some it just doesn't make sense for, especially when it's not available in every county in Montana. So
That's an important piece of
Yes.
information, and probably not available in every county across the U.S. either.
Right.
Okay, good,
So-
good point. Let's switch now and talk about standard enrollment period for Medicare in 2023. That's going to be around the corner here.
Okay, so our annual enrollment period, this is for prescription drug plans and Medicare Advantage plans, and it begins October 15th and goes through December 7th. So that is the time where you can look at your whatever you have, whether you have a drug plan or a Medicare Advantage plan, and see how that's going to look next year. Because what was right for you this year may not be right for you next year, because the companies can change their formularies and change their coverage and raise their premiums. So it's really important to look at your coverage for next year to make sure it's going to work for you. And so from October 15th through December 7th, that's the open enrollment period. Call your SHIP counselor early. I know this is the beginning of October when this airs, so call your local SHIP and set up an appointment. They can help you.
So you talked about the ability to maybe change your Part D plan and your Medicare Advantage. Is this enrollment period also an opportunity to change your Part B supplemental if you have a policy, an extra policy?
Supplementals are Medicare or Medigaps. Medicare supplements are different. They work with traditional Medicare. They are like 10 different standardized plans, A through L or whatever it is. The best time to get into those plans is when within the first 6 months of taking Part B, taking your Part B benefit. That's your guaranteed issue right period, and so that's the absolute best time to get into it, because after that they could deny you, or your premiums could be higher, or they might do some underwriting on the benefits. So it's really important to, if you want to go with a Medicare supplement, Medicare Advantage, or Medigap, is to do it your first 6 months. So.
Okay. And once you do it your first 6 months, the next year, do you have an opportunity to switch?
You can look into switching whenever you want. It's going to be up to the companies.
Okay.
Usually when you've got in under guaranteed issue rights, it's usually not a problem to maybe go to another Medigap or supplement that is the same coverage. So
Okay.
it's just going to be checking with those companies. So.
Okay. All right. So I think I know the answer, but how often can someone change Medicare plans? I think you touched on that.
Yeah, usually it's once a year. So October 15th through December 7th, that'll sign you up for the next year. And a lot of people are stuck or in that plan for the year. I shouldn't say stuck in, but so
Absolutely.
they would have to otherwise meet a special enrollment to be able to get into change plans during the year. So again, that's moving, going in or out of a long-term care facility, qualifying for extra help or Medicare Savings Program, or Big Sky RX.
What is Big Sky RX?
Big Sky RX is a local program. It started under the Schweitzer administration. It was funded through tobacco tax, and it helps those people with a little bit higher income and resources get some help paying their Part D drug benefit premium. So it's a great local homegrown program. But that would give you a reason to, if you qualified for that, that would give you a reason to be able to switch mid-year if you didn't like your plan or if it wasn't covering something that you needed it to.
So is the best time to sign up for Part D the same as your other Medicare plans, that same enrollment period, middle of October through?
Well, the initial enrollment for Part B is, again, 3 months before, the month of, and 3 months after you turn 65. If you didn't sign up during your initial enrollment period, the general enrollment period for Medicare Part A and B is January 1st through March 31st. And if you signed up for Medicare A or B then, your coverage isn't going to start till July 1st.
Okay.
There's also the Medicare Advantage open enrollment period, which is January 1st through March 31st. So at that time, you could switch Medicare Advantage plans. You could leave a Medicare Advantage plan, go back to original Medicare, and get a Part D plan.
Okay.
So.
All right. Very good. And Part D, again, is the drug benefit.
Drug benefit, yes.
Very good. What other changes are coming up for Medicare in 2023?
Well, we don't know a lot of them at this time. We should be hearing about them any minute now that we're, in October. So I'm sure there's going to be a change in the premiums and stuff like that, but we really won't know until probably this week. So
it's usually in September, August, late August, that we know changes for the
end
next
of
year.
September, early
End of
October.
September. Okay.
So
all right, right around the corner.
Be looking for your Medicare new book.
There you go. Absolutely. Well, Janet, we are about out of time. Thank you so much for joining us today and sharing your wealth of knowledge.
Thanks for having me.
Absolutely. And thank you to our viewers. So we appreciate you, and we hope that you'll be joining us next week. And until then, stay fit, stay well, stay healthy for life with Healthy Living for Life. Thanks, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.